Do physicians attend rapid responses at my hospital? Okay, I can only speak for my hospital. I can't speak for all hospitals, but you guys should let me know as well. But the providers tend to not always come to the rapid responses at my hospital. It truly just depends on the provider and the situation. Maybe the provider's close by and they hear like, oh, hey, that's my patient in that room number and I'm right down the hallway, so they'll go there. Some providers just are very good about like paying attention to that and they will go to the rapids no matter what if it's their patient. But I would say the majority of the time the providers don't go to the rapids. It's more so this rapid response team comes, which is like your SWAT nurse, critical care nurse, your RTs, and they will kind of assess the situation and get a hold of the providers that they need to get a hold of to either, let them know, get further orders, or maybe potentially we need to transfer that patient to a higher level of care. When it comes to intubations, especially like at a rapid response, how it works at my hospital, and again, I'm a day shift nurse, so it's going to look a little bit different for the night shift, but we will just call one of our critical care intensivists and say like, hey, this patient needs intubated, and they will usually trust the ICU nurse's judgment and come down to assess that patient. Or if the patient can hang steady for a second, we will transfer them to the ICU if we have an open bed. The night shift, usually this defaults to like an ER physician, or if there's like an anesthesiologist that is available to come intubate, then they would do that. In general, I really don't enjoy intubating patients outside of the ICU just because if things go wrong, like it can just be extra chaotic. We're just used to intubating in the ICU. We have all of the necessary like suction setups and everything like that. And when we are on the floor intubating, sometimes we're just a little bit more limited in space and in equipment. A lot of times we're going to the ICU to bring things that we need. So it's just a little bit smoother of a process when it's in the ICU. Not that we can't intubate somebody on the floor. Like we can. And by floor, I don't mean like the ground. I mean, we could do that too. But I mean like on your tellies and your med surges or outside of the ICU. Okay, I hope that answered your question. Let me know if you have any more.